Thank you, Steph. As Ontario reported another record number of daily cases yesterday, it was not Toronto leading the case count. Peel region overtaking the city with 468 new infections, and Ontario reporting a record high of more than 1,400 cases. Peel was moved into the province's red zone over the weekend, but is imposing even stricter rules than are required. Toronto will be joining Peel in that red zone on Saturday. Meanwhile, Ontario is set to release its updated modeling today for forecasting our second wave of COVID. This, as some experts say, the province will be surpassing 2,000 new cases a day by early December. This comes as the province sees a surge in infections. Over the past week, the daily average has been more than 1,200. And want to just get you an update on something we've been following here. An elderly man killed after being struck by a vehicle in Brampton. Peel police called shortly before 9:30 last night to the area of Queen and James Streets. That's just west of the 410. The driver did remain at the scene. Right now, we don't have a word on charges. Again, we're continuing to follow that story. Okay, so let's get back to COVID-19 now. As our city, again, we are seeing some major numbers when it comes to COVID-19. Our city is increasing those restrictions, moving into that modified red zone starting 2 days from now until at least mid-December. So what does that red zone mean? And could we see more restrictions? Could we see anything lifted? Joining us for our weekly check-in, Mayor John Tory. Good morning to you, Mayor.
Good morning, Mel.
I know it's not the news you wanted to deliver. I know there's a lot of pressure on you and Dr. Davila and your team in what to do next, but how confident are you that this is the right step?
Well, we have to take the best advice we have and that we can get, which we get excellent advice from Dr. Davila and from her team. And then we are also informed, I think, by best practices from around the world. So we're not going to bring forward measures that we don't think are going to make a difference, especially when you take into account the price that's to be paid for some of those measures in terms of the disruption to people's lives and the disruption, obviously, to businesses. So, we think that the things that we brought forward 2 days ago that will be taking effect this Saturday are going to help. We wouldn't bring them forward otherwise. I mean, these are deeply difficult decisions to make in the context of, trying to place health first, which we must do. But at the same time, also taking into account the impact on people and on businesses and on their lives. We can bring forward all the measures we want and all the rules and orders and recommendations and advice. I mean, if people really just did, what we have been saying for a long time, which is to stay home, to not socialize with people they don't live with, to not have people over, to not go out and visit other people. If they stayed home, except for going to get food, except for exercise, and except going to work or school, and even then we've sort of said to people we think it would be much preferable if they worked from home, which a lot of people are doing. But if everybody did that, I absolutely am confident these numbers would change right away. The trend lines are very, very disconcerting. And I think you're going to hear, worse today in terms of that trend line. And, it heads us in that direction where we start to get into situations which we've seen in Peel, which we have not yet in Toronto, where the hospital capacity starts to get stressed. And, then you're into something that's entirely different.
Are you aware of where our hospital situation stands right now? As you mentioned, Peel region, they are at capacity. Where do things stand in Toronto?
Well, it's very interesting. It's all public, and people can go look at it on the Toronto Public Health website. Our dashboard has been there, and it reports on this every single day. And our hospital capacity has been, it's been going in the wrong direction, but very, very slowly, so that there still is capacity in the Toronto healthcare system. But when you see the kind of case count increases we've seen in the steady levels of case counts, even in Toronto, where it's not as bad as Peel, that is where you have to watch very carefully, because it doesn't take much to tip you over that line that sort of goes from okay today, where there isn't an apparent problem, to something that's a problem very suddenly, like in a matter of a couple of weeks. And so that's why what you want to do is arrest the case count now, so that you don't get to the point where all of a sudden the ICUs and the hospitals are full, which today, if you look at the Toronto Public Health website, they're not. Then you start having, other effects as well, which is things like people who need surgery and healthcare for other things entirely unrelated to COVID start being unable to get it. And you have COVID patients that can't be coped with properly. You have a spread into long-term care, which we're seeing to some extent now, and those people suddenly need to be transferred to the hospital, and there's not the capacity to deal with them. We've seen this everywhere else, and so you just don't want to get there, and that's why we're all acting on the advice of our experts and our medical officer with a great sense of urgency, so we don't get there. And if that ever happened, you would then have a much worse lockdown from the standpoint of people and their habits and their business and their, their livelihood than we have today, just because that's what you'd have to do. We've just seen this elsewhere. And so I just hope people might think about changing their own behavior to take account of what we've already seen and what we already know from other places.
When we look at this color-coded system, Mayor, a lot of people say it's confusing. You know, we were in these we were in these stages, and then it was modified, and now these color-coded. You can imagine it becomes confusing, and a lot of people just say, what does this all mean? Do you think that there should be something that's blanket for the province that people can understand? Here's what it is, or do you think it should remain regionalized?
It's hard to keep up with it because it's been changing. Look, the virus itself is hard to keep up with. There are so many unknowns about this, and so things change only because we learn more or we find better ways to do things. But let me give it to you right now for the GTA. I can't speak for all of Ontario, but for the GTA, and I'll speak specifically to the City of Toronto, please stay home. Please stay home. Don't socialize. Like, don't make an excuse, well, it's just two friends, or it's just my Uncle Frank, or it's just my grandmother. Please stay home. Please don't go and visit other people. Please wash your hands. Please wear a mask anytime you can. Anytime you can. Please keep your distance from other people wherever you are. You know, wherever you are, even at home, it'd be better, I think, if you kept your distance from other people. But there, it's a little bit different because you're living with the people. Please avoid crowd scenes. You know, I think if people just followed that and forgot about red, orange, yellow, pink, purple, green, and anything else, then I think they would actually understand all that they have to do, which I know is a lot, but I think it's fairly straightforward if you put it that way. Please stay home. Please don't socialize. Please wash your hands. Please wear a mask. Please keep your distance from other people. Please avoid crowd scenes. I mean, these are things we've been saying consistently, and the best advice we have is that will do a lot.
Thank you for that. Some people will hear that and say, well, that's easier said than done. We're looking at Christmas, a month and change away. And do you think we are on the path, if we do have these restrictions, if we do everything that you said, that we can, it sounds corny, but save Christmas?
Let me flip it around the other way, Mel, which is I think if we don't do these things, then Christmas will be like Easter and like Thanksgiving, which is entirely unsatisfactory to people because everybody will be told to stay home and not mix with their family and friends and not have the kinds of celebrations we all enjoy. And, I think we sort of proved to ourselves in the spring when we had a much broader close down. A lot of businesses, all the stores and so on were closed. We can do it. It wasn't great. It was very bad for business. It was bad for people. They didn't like being cooped up and so on. But I think if we get back to sort of acting much that same way and going, I believe that we can have a greater hope of Christmas. And believe me, I sit here, I don't want to be conveying bad news to people. I mean, in my job, you want to be conveying good news anytime you can. And it's just heartbreaking to sort of talk about Christmas in a very negative sort of way. But I think there's a much better chance that we can have the Christmas we all want and the Hanukkah and all the rest of it, all the holidays, New Year's, if we do the things that I just talked about. If we don't, I think it's sketchy as to whether we'll be able to do that. Very sketchy.
Last one for you, Mayor. We've had a lot of discussion here at Breakfast Television about being outdoors and what people can do outdoors that is safe. And we were talking about Nathan Phillips Square and skating. Is the rink going to be open this year?
Oh, yes, it's going to be open. But we're having discussions, and I'll just be perfectly honest with you. I mean, we're having discussions about what we need to do. That rink has never, except for a couple of times we've had exhibition hockey things there, had boards or any kind of barriers around it. So one of the great things about it is it's completely open. People can just hop on from any place in the rink and that sort of thing. But if we believe, like we did with swimming pools, that you have to have some capacity limits, that you have to have some time limits, that people can stay there just to avoid overcrowding and whatnot, it may well be we have to put up some kind of a barrier or some boards or something to allow access points where people can be checked to make sure that we've taken their temperature or recorded their name or whatever it is. So I am saying that I think, my guess is the officials are working on it. There will be some limit placed on that rink to just make sure people stay safe. So it'll be open, but there'll be limits on how many people can go on and how long you can stay and some checking that's done at the entrance, as it were, to just keep track of who's there for contact tracing. Otherwise, if you think about it, it's a crowd scene that I've just finished saying people shouldn't be taking part in. And so what you want to do is try and make sure we can keep it open. And it may well be the case. Look, this is the kind of thing, and I'm just being, again, straightforward with you. This is the kind of thing where if things keep getting worse, there'd be no way we could impose proper rules to keep that safe. And we may just have to say, you know what, sorry, discretion is the better part of valor. We're just going to keep it closed. But I don't want to get there. You want to think that people can cooperate with us and we can put rules in place so people can have a skate, because we say to people, we want you to exercise. We want you to be outside. It's safer to be outside than inside. And so we're going to try hard. But as of the moment, our plan is to try and find a way to keep it open. But again, all bets are off if the numbers keep going in the wrong direction.
Okay, let's hope we can keep that open. Mayor Tory, you've agreed again to stick around for what's in store with Dina.